Hi, I'm Dr. Sana Azim, a specialist gynecologist and a women health advocate. Today we are going to talk about the silent struggles and the powerful journey in a woman's life. As a gynec, I see ladies at their most strongest and also at the most vulnerable. Motherhood is beautiful, but what if you feel lost? What if you don't feel like it? So this is called postpartum depression, and today we are here to discuss this with Dr. Vidya Susan Jose, who's a clinical psychologist in Eclipse Clinic in Jumeirah. She has more than 8 years of experience and she has supported and guided women through their emotional waves. Hi Dr. Vidya.
Thank you, Dr. Sana. As Dr. Sana said, I'm a clinical psychologist. I have been working in the mental health field for the past 8 years. And yes, I have worked with a lot of women who had issues with postpartum depression.
Is postpartum depression the same as baby blues, or is there a difference?
Yes, there is a difference between postpartum depression and baby blues. Baby blues are short emotional changes which happens right after the delivery. So it will be 1 to 2 weeks of the period of after delivery, and it will usually goes by itself. But postpartum depression is different. It is persistent low mood or persistent emotional changes which is experienced by the mother, and there will be lack of interest to take care of the child, hopelessness will be there. Sometimes we have seen women with suicidal tendencies too. The mother is not interested in taking care of the child, and also there is a low mood. So persistently they are telling that like they don't feel like doing anything, or maybe they don't feel like holding the child, and they have like crying spells. So these are some of the signs they have to look out for, and also keep this in mind. If this is persisting beyond 2 weeks, that is a time to seek support.
A lot of females are being judged and labeled for it. So how can we normalize asking for help? Also, do you think any of the emotional or societal factors contribute to it?
Yeah, that's a very nice question. Yes, definitely. I would say there is an unrealistic expectation which is given to the new mothers.
Yes.
They just need to bounce back to everything. Like maybe the societal norms of looking good is also being, and they need to put together for everything for the family. That's also so we all know the culture that we come from also will have certain roles that they need to fulfill.
So at what point should a mother seek help, and how can family members and partners support?
Seeking help at the earliest is the best option. So if you notice any symptoms persisting after 2 weeks, please seek help from a professionally trained mental health expert. And what can be done by partners and family members? So start with active listening. So listen to them with non-judgmental attitude, and also validate their emotions and feelings.
So as soon as you start listening to the patient, half of the illness is gone. But doctor, do tell us that how does the recovery look like?
Yes. So if they have already taken support and it's not delayed, definitely you will see changes like they start to be interested in taking care of their child, or also they will be doing their day-to-day functioning in a very active manner. Recovery varies across individuals, and recovery doesn't mean eliminating the symptoms. It means making the mother feel connected, empowered and emotionally regulated again. So remember, recovery can be attained through psychotherapy, and also sometimes needs medication too.
Last and the most important question. Women during this time, they feel ashamed. They feel guilty for their emotional state. So what message do you have for such ladies?
Yes, the struggle is real. So emotionally disturbed after giving childbirth is not making you a bad mother.
Absolutely.
It's just being human. Shame and guilt are common, but it is often stemming from the societal expectation that motherhood is a happy time.
Yeah, everybody wants them to be happy and get involved in whatever is happening.
Just understand it's okay to feel not okay. And support is available, your emotions are valid.
Dr. Vidya, that was very amazing and very important information that you have given. The women keep silent about these topics. So if you want to reach out to Dr. Vidya Susan Jose, who is the clinical psychologist, and me, the gynecologist, our information is in the link below.